Ladies and gentlemen, we're getting a bit of a late start today, so I'm going to try to move through this as quickly as possible. But first of all, I have a question for everyone in the audience. I want you to raise your hand if you've never broken a law. 3 people. And I want you to think that over. And the rest of you, I would ask you, if the law officer had been present when you broke that law, might you have been arrested? No? Sheriff, I think you better form a posse. We have a bunch of lawbreakers in this room. People make mistakes, especially young people. We want them to have opportunities to correct their behavior before too much harm falls to them and to society. Our theme today is alternative sentencing and how does it fit into a modern criminal justice system. Over the past several decades, Americans have grown fearful of violent crime. Images on the news make the world appear very dangerous, which it can be. In response, America and its so-called tough-on-crime politicians have instituted policies to incarcerate more people in this country than the next 10 Western countries combined. We now know that very few nonviolent offenders actually present an immediate threat to public safety. We also know that a high percentage of low-level offenders, perhaps even a majority, suffer from mental illness and trauma. Incarceration disrupts families, creates unemployment, a loss of health insurance, evictions, foreclosures, can put families on the street as homeless, and can bring about a cascade of unintended consequences and costs to society. And tragically, we know that sending a father to jail increases the chances that his son will follow. If we look away from these challenges, we store up problems for future generations. The panelists with us today are dedicated to measures that can help to turn around the lives of these people. I'd like to introduce, first of all, Deb Gardner, who is presiding commissioner of the Boulder County Commissioners. Deb is has served as a state representative and an accountant, and as an accountant, she's very sensitive to cost benefit. I know, having worked with Deb several times over the years, that she is a woman of great vision and compassion. Also like to welcome Joe Pelle, most of you know, our sheriff. Joe has been a lawman for over 30 years. He was chief of detectives at Boulder Police Department. And for the last 16 years, he's been our sheriff of Boulder County. Joe supervises some 450 employees. He serves on about 15 commissions around the country and the state. He is a very busy man with enormous responsibilities, yet he finds time for justice. Another panelist, Michael Dougherty, a Rotarian of ours. Michael is the new district attorney for Boulder County, but he's not new to prosecution, having served in New York City as a chief deputy in the district attorney's office there. Michael has been very active in the Innocence Project, and which seeks to overturn convictions for persons who may have been wrongfully convicted. So yet Michael is a prosecutor, but he also believes in justice and doing the right thing. And then our moderator today is our own Hans Wiik, who is current Mental Health Partners Executive Director. Hans supervises around 400 employees in the mental health field. Mental Health Partners is the primary organization for mental health in Boulder County. So thank you for serving today, Hans. We're going to start off with Joe Pelle, who's going to make an opening statement. Sheriff, take it away.
Thanks very much, and thanks for having me back here. So when I became sheriff in 16 years ago, when I became sheriff, about 13% of the people in our jail had a diagnosed mental illness. Today, 40 to 45% of the people in our jail have a diagnosed mental illness. Over 50% of the women in our jail have a diagnosed mental illness. Over 72% of the inmates in our jail have a substance abuse issue. Our jail was built in 1986-87, opened in 1988, designed to hold 287 people. It was full the day it was opened. And today we put up over 500 people in the same facility, double bunking and squeezing people into spaces. And so I've been trying to find solutions to jail crowding and being sensitive to the community and what this community desires, and having a good understanding, having grown up here, of where we are in regards to sensitivity and caring as a community. We're trying to find solutions that don't involve building a bigger jail. And so that involves a number of things. It involves, first of all, diverting people on the front end from the point of contact, people with mental illness, people with substance abuse issues. We ventured into a partnership with Mental Health Partners and others, funded by the county commissioners and the city of Boulder after a grant expired, to develop an EDGE program. The EDGE program is a co-responder model where mental health professionals respond with police officers to crisis calls. And hopefully, rather than ending up transporting that person to the emergency room or the jail, which was our only alternative prior to that, we put them in contact with mental health professionals on the scene, in their living room, on the sidewalk, where we encounter them and we get them into treatment. The second thing we're trying to do, we have just received 2 wonderful grants, one from the state, one from the feds, to implement a pre-filing diversion program for people with low-level crimes and mental health issues. And hopefully, they show up at the jail, we'll do a screening and an assessment. We're in the process of hiring a navigator, a person to help that person get connected with services, and hopefully we'll be able to divert them out of the justice system and into treatment, and stick with them a while and monitor them and help them engage. This whole jail issue with people with mental illness and substance abuse crises, it's a revolving door. And the jail, I'm proud of my jail, I'm proud of the people that work there, but it's not helping with those issues. Finally, we're looking for solutions because there are people that end up in the justice system who have serious crimes involving victims, crimes like stalking, sex assault, homicide. We're going to have to incarcerate them for community safety. And we're going to have to provide a higher level of service for them while they're in our custody. So that's the other area that we're looking at. We also just recently got a great grant to help people with opioid issues. And we are also trying to create an alternative sentencing program that's large, that has expanded capacity, where people that are not a danger to the community can go to their job during the day and come back at night, and we can help them with their sobriety by monitoring their sobriety, by putting them in classes with groups with evidence-based education and evidence-based treatment, and keep them paying their own taxes and on their own insurance, and hopefully buying groceries and sending them home. A perfect example is a DUI. A lot of people get convicted of DUIs because they have alcohol issues. A lot of them are convicted multiple times, but they don't need to be locked down in a hard jail cell. The only time they're a danger to you and I in our community is when they're drinking and driving. So if we can provide a level of supervision and monitoring and treatment that keeps them working, that keeps them providing for their family, that keeps them on their own insurance rather than the county's dime for medical costs, those kind of things, we can hopefully help them get better and save you all money. I could put somebody in an alternative sentence facility on work release or day reporting for about $40 a day. It costs $135 a day to keep them in a jail cell. So it's an investment that is worth our time and money. This is a multifaceted approach by a bunch of people in our county, including the commissioners and council people and our district attorney and police chiefs, who support an effort to not incarcerate as many people, but to get smart about the way we're handling offenders in our community, and to make sure that the appropriate level of services and the appropriate level of supervision is being given to people based on their needs, and that we're also providing some sort of interventions and treatments for them that's evidence-based, that helps them in that cycle, that keeps them coming back again.
Thanks. Is it on? Is it on? Oh, thank you. Joe said it all, and so I only have a couple of comments, and I'll turn it over to Deb. What Joe said is really critical. I think one of the things as club members, and everybody in this room should be proud of, you should know that you probably live in one of the most collaborative communities in this nation. I've never been prouder of a group of people, whether it's working with sheriff, county commissioners, or the DA's office, or probation, or jail. Every week, every month, this group sits together and says, how can we make our community better? And they do that in the sense of how do we also make that cost efficient? And what Joe says is correct. If we do alternative sentencing correctly, especially with people with substance abuse and mental health problems, we have a better community. We restore families, we keep people in their jobs, we allow them to be successful and reunite themselves. When people are in crisis, they end up in two places. They'll end up in the emergency department or they'll end up in jail, and that costs a lot of money, more so than if we provide alternative sentencing. And whether it's the EDGE program that Barbara started in terms of our diversion and having co-responders with law enforcement, or the PACE program and working in probation, we are trying everything possible to make sure that we can get people on recovery, because that's what it's all about. And if we do that well, then we live in a safer community, but also a community that cares, a community that really wants to help people, restore themselves back to their families, restore themselves back to their jobs, have pride, and don't sit in a jail where we can't provide services for them. So this is a critically important thing that I think this community should be very proud of. And it's something that we're looking not to expand a jail, but to make a jail better, and to also have alternative sentencing that allows us as mental health professionals to take care of these folks. We take care of them in the jail, but it's not the same as taking care of them when they're connected and can receive our services, whether for substance abuse or other dual diagnosis or other disorders, when they are available and we can see them on a regular and scheduled basis and have them monitored. And that's our sole intent, to do that. And so in terms of next, I'm going to turn it over to Deb, and she can tell you a little bit from the county commissioner's perspective.
It's on. Thank you very much. And thank you for having us here today so we can have this opportunity to talk to you about a subject that you may read about in the paper, and you may personally know an issue in your family, but most people don't encounter this part of the criminal justice system. We are very lucky here in Boulder County, as Hans said, in that we live in a collaborative county. The relationship that we have with our sheriff and with the DA and with the whole community is really unprecedented in a lot of ways. And so it means that we're able to work together to come to solutions. And Joe has been working with the county commissioners over the last few years about coming to a solution of jail overcrowding, but also how do we provide the correct services for people while they're in jail and when they get out of jail. And so it might have been easier to build a bigger jail if we'd done that route a few years ago, but working together, we've come to the conclusion that what we need to do is expand our alternative sentencing facility. We have a little bit of programming that we can do in the jail now, but we have folks housed in the jail, as Joe said, that really don't need to be there. They can be in a better place where they can still stay in the community. Larimer County has an alternative sentencing facility. Weld County has an alternative sentencing facility, and we need something like that here in Boulder County as well. And so I think there would probably be some folks that say, well, why don't you just pay for that out of the county budget rather than the commissioners voted unanimously to put a Proposition 1A on the ballot today that you'll see on your ballot if you haven't voted yet. And the issue is that it will cost us about $50 million to build this facility and do the modernization that we need to do inside the jail. That is just not possible within the current county budget. We need about $10 million additionally over the next 5 years to be able to build this facility. We'll be able to operate it we have the operating funds on an annual basis, but we won't be able to build it from a capital standpoint. And I think these large capital investments are things that we believe. We've done quite a lot of polling around this particular issue, and I think it was in the 60 and 70% approval ratings, because this community supports this kind of activity where now we can give the services that people need to be able to be successful when they leave jail. And as Joe, I think, has said many times, over 90% of the people that are in the jail at any point in time will be back out into our community. And so how do we serve them in a way while they're in jail so that they can be successful when they get out of jail, so that they don't stay in that cycle of getting out and coming back in and getting out and coming back in? We can stop this vicious cycle if we're able to give the services and support to people both while they're in the jail and then when they are out of jail. Because I think additional services need to happen in terms of we'll have alternative sentencing, but we also need additional services on both ends of that spectrum. More diversion, more help with mental health. We know that we need a mental health crisis center here or in our region, and that's the next issue we'll be working on statewide. But that's kind of, I guess, just from the commissioner's point of view, because we manage the budget for the county. That's the big piece and how we play into this. But this is a priority for us. And how do we work on the criminal justice system so that it's really working the way that it needs to work in our community? So thank you.
Good afternoon. I'm honored to be here today and have an opportunity to talk to you about some of the efforts that we're pursuing here in Boulder County as part of a collaborative approach and being smarter about dealing with substance abuse issues and mental health needs, particularly within the jail. And I can't stress enough how important it is, especially when we look at the impact it has on our community. I could argue with great passion that you could judge a society based on how we treat our prisoners. And I really believe that. And perhaps you don't agree, in which I would share with you the second part of this, which is Commissioner Gardner just hit on a major factor for all of us, that over 90% of the inmates at the Boulder County Jail are going to be released back into the community. So we have a vested interest, not only doing what's right as Rotarians and as community members, but also in helping those people get back on the right track. We've seen our share of horrific cases, and we have a lot of serious cases. We've had a rise in violent felonies in Boulder County from 605 in 2013 to over 900 for this year. But part of what we can control is the rate of reoffense. And we could do that by focusing more on substance abuse treatment and helping people with mental health issues. For example, a guy I met at the Ready to Work facility in South Boulder, his name's Brent. He shared with me that due to a mental health disorder, he's been arrested 35 times in the last 5 years. All low-level offenses. For Brent, for the community, for taxpayers, we have to make every effort to keep Brent from being arrested a 40th time, 45th time, 50th time, and helping him with his mental health disorder. By the way, I'll share with you that Brent is a huge guy. After I met him, I was walking with my 10-year-old twins by the Boulder Creek a week later. They're my elite DA security team that I have. I heard some guy yell, "Hey, Mr. DA!" And I look, and it was a large man, and for a moment, I jumped out of my skin. But it was Brent. And he said, "I really hope you're doing something with the mental health diversion program you talked about at the shelter, because we need that." And he's right. We all need that. We need these kinds of efforts to help people get back on the right track. At the state level, 48% of everyone released from state prison is back in state prison within 3 years. That's a failure rate that none of us would accept in our businesses or our offices. We should not accept it in our prison system. It's what drives this state to have private prisons, which quite frankly I think should be banned. We shouldn't have for-profit prisons with the incentive to put money in their pocket. We should have every dollar going into treatment. That's what we're doing here in Boulder County, making sure that we put every dollar and every effort and every ounce of energy we can bring to helping people get back on the right track, to help them, but also to help the community be a safer place. Thank you.
We have about 10 minutes left, so I really want to allow any of you to have any questions that you have of anybody up here. One last statistic I'd share. When sitting in some meetings with Joe, you think about how that environment is. He said that a few years back, he had about, 200 to 300 suicide ideations?
We went from 150 to over 800 annually.
Think about that. We have people who are seriously ill who need support. We don't need another suicide in the jail. We need people to be supported, and we need to provide them help. So this is a really important collaborative. You should also know that we probably have one of the lowest incarceration rates of any city in the country, because we really do emphasize alternative sentencing. We want to take care of these people, that once they come back to the community, they have a community that cares and really wants to support them in terms of having them to be meaningful contributors back to the community. Some are transients, that's to some degree, but a lot of them are our citizens, and these are people that for even low-level offenses, we really need to make a strong commitment to help them get back on track. And with that, if you have any questions, there's a microphone right there.
I have the microphone, so I'll ask. Thank you so much. I know we all appreciated each one of your points of view. I wanted to ask a question because I didn't hear it come up about nutrition. I have a strong interest in that. I also know the value of things like specific diets that might affect and alter the behavior in a positive way. What is being done currently in the jail system regarding nutrition of those interned?
We contract with Aramark, a national company that does all kinds of vending and jail programs throughout the country, prison programs throughout the country. We used to have our own cook and our own nutritionist in the jail and our own staff, and the meals were prepared by inmates. About 6 years ago, I had to switch to a contract. It saved us about $100,000 a year over what we were spending on food. We're budgeted at about $3 a day per inmate to feed them. So the one thing that is cool that we're doing is we have an 1.5 acre vegetable garden. Last year, our inmates, with the help of Master Gardeners from the Extension Office, raised about 18,000 pounds of fresh vegetables, which we were able to put a lot of that in the jail, in the freezer, and we were able to donate a lot of it to community food shares.
We've got an election coming up, and there are items 1A on the ballot, other things that may be appropriate at this point in time to maintain this kind of progressive initiative. Are there other things that we should be aware of on the ballot that we should consider?
The majority of the things I've seen on the ballot have to do with transportation, and they are confusing a little bit because there's a number of them. On a local level, this is the only county ballot item I'm aware of. And as far as cities go, I'm not aware of any other city tax proposals or anything else. This proposal is to extend a sales tax that expires next year for 5 more years. Tax rate stays the same, and we raise the capital to build the building and remodel that 30-year-old jail. That jail's like me, it's an aging structure. It's starting to have plumbing and electrical issues. We need to fix it up. We need to build more space for women. We need to convert more space for mental health care, that kind of thing. I have staff that we brought on. In 1987, we didn't have mental health staff in the jail. Today, we have 9 people working from 3 different agencies in the jail. They don't have offices. There's just a lot of need around that. To emphasize what Deb said, this is a $50 million capital investment. We're going to be able to operate without additional tax dollars, but we just need a boost to build the darn thing and remodel that old jail.
Well, maybe I just add, there are a couple other things on the ballot that are important. Voting for Mr. Dougherty and voting for Mr. Pelle. They probably wouldn't call themselves out, but, and they don't have a lot of competition, but it would be good to get them going.
I assume that a lot of the people who are being released from jail now, one, are under supervision from community corrections, and two, are also having ankle bracelets, which are being used to, one, make sure where they are, but two, to see if they're using drugs or alcohol as part of the ankle bracelet. That's been helpful.
So one of the other things that we're doing, and this is a national trend, but we're doing it in our county, and we're doing it in collaboration with the district attorney and the public defender, is around bail reform, bond reform. But what we know from the data is that cash bonds have nothing to do with whether someone goes to court or not when they're supposed to, and they don't do much for public safety. What works for public safety is pretrial screening and pretrial supervision. A lot of people can go home and be helped with their sobriety, be helped with their, tardiness issues and their job issues, that kind of thing, and go to court and resolve their issues. So we have a strong pretrial supervision system and a strong community justice services department funded by the county to help people with that. Our PR bond rate has gone up 150% since we implemented bond reform. And it isn't affecting public safety. It's not affecting whether or not someone's going to appear in court or not. So we're pretty proud of that as well.
I'm a retired civil trial lawyer, but it's been many years since I've done any criminal cases, and I'm not up to date on that. But I'm curious whatever happened to not guilty by reason of insanity, in which case a defendant would initially be put into a mental hospital rather than a jail from the get-go. Why aren't so many of these? Why are there so many people in jail that have mental illnesses? My question is, why didn't they go to the mental hospital?
So the
facility in the first place?
And Michael's going to have to chime in on this, but I'll tell you what I know. I chair a commission on mental illness for the Criminal Justice Commission for the state, appointed by the governor's office. What I know is competency evaluation requests have gone up 500% in our state, and the number of beds available have been cut by several hundreds. Right now, for us to get somebody to the state hospital in Pueblo, we wait for sometimes over 3 months to get them down there. There's been new legislation that allows for some competency evaluations and restorations to occur in the jail and in the community. However, the jail cannot forcefully medicate someone. Only a hospital can do that. And some folks require that in order to stabilize them. And we don't have the ability to do that. So in the meantime, we're stuck with issues like restraining them and observing them on a 24-hour basis. The system is not a system, it's broken. It needs a lot of help. And we need to work with our state legislators and other people to get funding for mental health treatment and restoration back at a level where it needs to be for the state.
And I think your question goes to something I strongly believe, and all four of us are united in, which is the last place for a person with a serious mental health disorder is a jail cell. They should not be there. So we do have mechanisms under the law. We still have not guilty by reason of insanity. We have mental health defenses. Sheriff Pelle is correct. There's been a spike in the number of mental health evaluations pursued as part of a defense in a criminal case. The backlog for those competency evaluations have a real impact on the court system. So if someone has a mental health defense and they're being evaluated for competency, they go down to a state hospital in Pueblo. That can delay a case, which already takes, on a felony case, we take anywhere from 6 months to 13 months to resolve the case. Add a year if there's a mental health evaluation involved, roughly. So we had a trial over the summer involving a mental health defense, a murder case. That family had waited 2 years for the case to go to trial, the victim's family and the defendant's family. And that's because the state has a backlog. We are ranked as a state 43rd in the nation in terms of the resources we commit to mental health treatment. So what we're trying to do in Boulder is become a leader in this area and do what we can on the criminal justice side with a lot of help from the county commissioners to make the system work better around mental health issues.
Last question, Diana Sherry.
Back when I was director of Boulder Reads, I spent a fair amount of time in the jail supervising literacy volunteers and also running workshops. And one of the things I noticed was how sort of activating that environment was in terms of the really bright lights, noise just bounced off the walls and the floors and the ceilings. And every so often you'd have an inmate in one of the cells just yelling or screaming even. And so I just remember thinking that it would be a really activating environment for someone who did have a mental health issue. So I'm sort of wondering whether if 1A passes, will there be things you can do to make that environment at least a little, not activating for people with mental health issues to the extent that they're stuck there?
Yeah, you're right. It is an aggravating, it's concrete and steel with fluorescent lights and too many people. Everything's double bunked. Every corner, every nook and cranny is occupied by somebody or something. So what I want to do is take everybody we possibly can that doesn't need to be in a hard jail cell and move them into a better environment. The building I want to build is going to be open architecture, sort of barrack style, dormitory style housing, warmer, with places for groups to meet, for classes, that kind of thing. And then we need to invest, and that's going to be probably $27 million, that 46,000 square foot building. What it does, though, is it gives us quite a bit of fund balance to remodel the jail. When the jail was built, we had a very, very small population of women. That's exploded because of, I think, the opioid and mental health issues. We need more dedicated space for females. We need more dedicated space for people with mental health issues. We went from 150 suicide protocols, in other words, our need to observe someone closely so they don't kill themselves. We went from 150 a year about 15 years ago to over 800 this year. And we have 15 cells in the jail as it's designed where we can do direct observation. Obviously, that needs to change. There's a bunch of people in the jail that leave the jail on a daily basis to do work release, to work in the garden, to go out in the vans and work in the community for governments and nonprofits. They don't need to be in there. They could be in this new building. And we can remodel and rededicate space in the new building. And I also want to build space specifically for people who are transitioning back into the community where they can get a really high level of transitional programming before they come back and before they are neighbors again. So yeah, we got a lot of things and a lot of plans. We just need the dough to do it.
And I would just add that you really captured the reason I so strongly support 1A. I've been in jails and prisons in New York, Colorado, and California. And when I visited the Boulder County Jail, I left recognizing that it's far too old and far too crowded. And as a result, it places a lot of people at risk, not just the inmates, but the defense attorneys who are there and law enforcement and Joe's staff. And they do an incredible job. They're really dedicated, tremendous professionals. But because of the structure itself, we're denying people substance abuse treatment and mental health treatment who really need it before they come back into our community.
Thanks. Oh no, it's working. I was asked to respond. There's nothing I can add except to say these guys work really hard on these issues. I know because I've sat in many of the meetings. This idea is a very collaborative, progressive idea, and I strongly urge you to support Measure 1A on the ballot this year. And as the responder, I have the pleasure of informing you guys that Boulder Rotary Club is pleased to contribute 100 doses of vaccine to the Polio Plus Fund in your name. Thanks very much.